Doctors Without Borders have joined hands with the Office of Mayor, and here is an exhibit forced from home right at the backside of New York Hall of Sciences in Queens, which tells the story as closely as can be told with the help of all the exhibits, which takes us to the life of refugees, what their aspirations are, what their dreams are. Dr. Sharmila, welcome, and I'm so glad and I'm so proud that coming from Indian background, you have chosen to go beyond boundaries with this organization, Doctors Without Borders. Tell me, how long have you been a part of this, and after you became a part of Doctors Without Borders, was there any regret?
Sure, so thank you. I first got involved with Doctors Without Borders in 1999. I'm a pediatrician. I had finished my residency and I decided that this was the kind of work that I wanted to do. So the first job that I had after graduating residency was going to Lebanon with Doctors Without Borders. And I've been to 4 different countries throughout the years up until recently. So I've worked in Lebanon, Sudan, Uganda, and Myanmar or Burma. And it's been an incredible experience. I absolutely have no regrets whatsoever. It's a very fulfilling and rewarding job to go. Like, I always wanted to be a doctor to help people, obviously. I think that's what most people do. But I wanted to go help where the need was the greatest. And I think this is a perfect way of really going to where the need is great. So it's the most rewarding job that you can ever have. So I have no regrets. One of our founding principles is impartiality and neutrality. We treat anybody regardless of race, political affiliation, religion, etc. I mean, it's Doctors Without Borders. We're providing services to everybody. And I mean, I think some of the things that I've heard when I've worked out in the field in some of these different communities, people will say, the patients that I work with will say, thank you so much for helping our people. Thank you for not forgetting about us. So you get that sense that at the end of the day, we're basically human beings, and we all have the same needs. We all have the basic same needs.
So New York welcomes those who reach here by their own will, or people who have to find a shelter.
That's absolutely right. And my parents' story is one of choosing to come to America and having been able to do so. But we know now that there are 65 million people around the world who are being forced from their home, largely due to violence and conflict. And New York will welcome and accept all who are seeking a safer place and a better future for their families.
Now, in that context, when you see the kind of political narrative which we hear in the presidential race, especially these days, how that is likely to play out, whosoever becomes the president?
Well, the narrative, unfortunately, is very toxic even before the election has reached its conclusion. And so the work we've been doing in New York City is to really combat that message, to say that we provide services, we provide an inclusive city. Our narrative is very different, so that at least for people who are in New York, they have a different story that they're hearing about immigrant New Yorkers, about refugees, about a range of different groups who are being attacked now nationally.
But again, I mean, I think in a lot of the places that we work, like some of the innovations that I think that we've started using in some of our projects in the field is telemedicine. So in places where we physically cannot go, there are some places that are just too dangerous to send volunteers like ourselves to go. So basically we work with some of the local doctors, and they're connected through video and audio feed to doctors in other parts of the world, and they can guide doctors locally with surgeries and things like that.
So now, policy level in New York at the moment, do we have some structure in place for refugees?
So New York City is not one of the top main places where refugees are resettled, largely because it's very expensive to be here. But what we find is that many refugees may start somewhere else in the United States and then come to New York City, because this is where their communities are in large numbers. And so my office works with those groups. We provide services like the city's municipal ID card. We provide free legal services. The city has public health services that are available to all. So that's what we do, is make sure that those communities are aware of what the resources are that are available to them.
And in the last 2 years or so that you have served the community as Commissioner of Immigrant Affairs, what do you think has been the main concern that was brought to your attention?
You know, we hear a lot of concerns, but I think the big one that we're hearing now is around this hateful messaging, and we're seeing crimes and attacks happening on people. And so recently, in fact, just yesterday, we brought together immigrant groups, refugee groups, Muslim community leaders, faith leaders, to talk about how we can respond to some of this harassment, some of this rhetoric, and that's our goal for the future.
This is an example. This is actually what you would normally see in a refugee camp. The clinic might be just a tent like this, and we would provide some very basic services. These cots you don't see all the time. This is if there's a cholera epidemic that's going on in a camp, we quickly set up a tent. We'll set up a cholera tent, and they will have these cholera beds. You could see there. This is. Water with chlorine in it, because basically if there's cholera, it's highly contagious. You have to wash with chlorine and water.
Sure, having heard that from the community.
Life unfolds experiences for us differently, and how Dr. Ahmed has embraced different steps of challenge in his life, becoming a refugee and continuing to serve as physician, and then becoming a part of Doctors Without Borders. So I have the pleasure of talking to you here at New York Hall of Sciences, where the exhibit Forced from Home has been displayed at a very appropriate time and period. So let's learn a little bit about your childhood.
Well, I was born in Iraq, and I left Iraq when I was 14, 15 years old. And in Iraq, we went through a lot of challenges. There was the Gulf War, which was like 1990, and through that time we have to face like the shelling, the bombarding. That was like next to our home. Like we had each time if there was like a plane or flights like this one. We had to run away and hide ourselves in a place like the basement. So if the home would collapse, the only place that would hold would be the ceiling, the second or the first ceiling.
So right now I'm well dressed. Of course, I'm here to report, but this is New York Hall of Sciences, and this is a small tent. So the reason I brought you here, Sharmila, is to get your perspective on the way these people are dealing with such a situation in terms of their emotional reaction, in terms of their interpersonal relationship with each other, and probably these people once have led a normal life. So to sit here and imagine that they live in these kind of tents for years or months at least.
Yeah, no, that's a really good point. I mean, if you look at, for example, people that are coming from Syria, they had a very high level of education, a standard of living, and they're on the move, and they have to live in these kinds of tents. I mean, it's really difficult. A lot of the work we also do, and you mentioned their, what it does to their emotional, mental state. As you can imagine, it's going to have a significant impact on the way you see the world, and it's going to be very traumatic and very difficult. So in a lot of places we actually have mental health programs. We have a number of psychologists and psychiatrists that we have on staff that work in these kinds of areas and provide psychological and psychosocial support, because yes, you hit it on the head. It can be very damaging psychologically. And if you can imagine also children, the things that children see, they can see bombings, they can see people being killed because of the wars. I mean, it has a real psychological impact on them. In this exhibit here, in this tent, it's virtual reality videos. So people who take the tour can come here. I think there's 5 different videos. You put on the virtual reality glasses and you can get an idea of like a virtual reality video of the different places that we work in.
And you? And then you follow the blue dot, and that's how you control it with your eyes if you want to make a selection.
So then you press somewhere or no?
Now, with your eyes, do you see the blue dot?
Yes.
Yes. With that, you make your selection.
Oh wow. So now I'm somewhere post from home exhibition. It was hard to leave everything we had worked for. This is an amazing technology which I cannot share with you, but let me just say that I am at a place which, as I turn all around, I'm near a railway track and small segment somewhere. So this, I am saying it with smile because I think kids would love to learn about the condition of refugees with the help of technology, and it actually transports you to a totally different place. Man. So this is an incredible way of making kids aware about, or anybody for that matter. So you have seen these videos? You have seen these videos?
Yes.
Say something about it briefly.
Well, I feel like it gives you an experience that not everyone can have. You feel like you're at the actual place, which I think it gives you that sense of understanding things better because you feel like you're there. So I think that's why these are so great.
And see, as they say, happiness and sorrow go together. So in spite of we are talking about suffering, but there is fun involved here because the technology has its own fascination, and I see a lot of faces smiling because when we approach something differently and with a sense of newness. Share with me the seed of this thought, how it came into being.
Well, as an organization, we work in close to 70 countries, and most of those countries are places at war or on the periphery of wars. So we know these 65 million people, many of them are our patients that we treat every day in our clinics and hospitals. And so, part of the work that we do besides taking care of people is bearing witness to the experiences and the suffering they're going through. And this exhibit is very much part of our mission, which is to tell their story, to bear witness for our patients. And that's why here today we have some of our aid workers who've worked in countless war zones to tell people about that reality and really take people through the experience of what too many people are facing today of having to be forced to leave their homes.
Please help our viewers understand the scope of the work that is undertaken by Doctors Without Borders in terms of the number of doctors and volunteers which are a part of this.
So we have about 35,000 people that work in the field for us in those close to 70 countries we work in. For every one international staff that we have coming and working in our programs, we have another 10 locally hired staff. So it is huge in the sense of the scope. We treat over close to 10 million people every year in our clinics around the world. We respond to epidemics as well, things like Ebola, cholera, measles, and other diseases. Many of the same kinds of diseases that many refugees face in different camps around the world.
So a lot of what the treatments that we do, a lot of the projects that we work on is malaria. So this is an example. You can see some beds with some mosquito nets, and this is really for the prevention of malaria. So if we have patients that come in with malaria, we can basically do a rapid diagnostic test. We can do a quick test. It's just a finger stick with 1 drop of blood. We can do a test, and within 10 minutes we can get the result. So if they're positive for malaria, we have the pills that we would just give this whole packet of pills to the patient.
So
They
it
would take
feels
these,
like
and we would
we
also
are,
provide them with a bed net, so to prevent them from getting further episodes of malaria. Yeah, so this is just the final tent. This is sort of, we call it the take action tent. So basically, after you've learned what you've learned on the tour, this is ways that you can help support, the cause. So, you can send a message of support to people in the field. You can leave comments. There's also a lot of things on social media that, people can try to spread the word about what they've learned in this exhibit. So this is just how you can help, how you can take action. So this exhibit will be here until Tuesday. So this coming Tuesday here in the New York Hall of Science. But then I believe, I think it's Thursday or Friday at Battery Park City, there's going to be another tour. So another 4 or 5 days in Battery Park City as well.
And also, as I stand with Sharmila and I think about how each faith also encourages us and inspires us to be more compassionate, etc. But also, at some level, humanity is the only religion that is the feeling which you get. You have been at all these places, people coming from whatever faith, whatever country. Did you get this similar realization?
Yeah, absolutely. I mean, one of our founding principles is impartiality and neutrality. We treat anybody, regardless of race, political affiliation, religion, etc. I mean, it's Doctors Without Borders. We're providing services to everybody. And I mean, I think, some of the things that I've heard when I've, worked out in the field in some of these different communities, people will say, the patients that I work with will say, thank you so much for helping our people. Thank you for not forgetting about us. So, you get that sense that, at the end of the day, we're basically human beings, and we all have the same needs. We all have the basic same needs. And we're all human beings, and it doesn't really matter what race, what religion, etc. you are. We're all one big family.
So this exhibit about the refugee camps organized by Doctors Without Borders at New York Hall of Sciences, reporting and sharing some of the exhibits from this remarkable human-oriented exhibition. This is Ashok Vyas for ITV.